around the room and introduce ourselves. So I am Maria Ortiz. My co-chair is
Joe Restuccia.
And we are the co-chairs of Housing, Health, and Human Services. Tonight, we're having our April 2022 meeting. It's held the third Thursday of every month. Per the governor's order, we can still meet remotely. And this is streaming on YouTube. It'll also be accessible after the agenda, and most of the materials, all of the materials at this point are public and can be viewed on the CB4 website on the I don't remember if there's a link to the Dropbox, but if this is your first meeting, I would encourage you to sign up for to be on the listserv so you can get e-blasts about the agendas and the links to the documents for the meeting beforehand. If it's your first time, 3 things to know. After each presentation, first, the committee is going to ask questions and make comments, and the members of the public get a chance to do that. Second, in order to speak, you have to raise your hand. You have to raise the hand button on your screen. Is anyone calling in?
No.
No? Okay. And after the attendee, the third thing is after the attendees speak, the discussion goes back to the committee, and on some agenda items, committee members will vote to write a letter of support or write a letter to make recommendations. And let's go around the room, starting with Sabrina, and introduce ourselves.
Hello, my name is Sabrina Ravron. I'm a committee member.
Leslie.
Leslie Williams, committee member.
Betty. Betty, we can't hear you.
You must unmute, Betty. You must unmute at some point.
It's 2 years, Betty, 2 years.
Can't believe I did that. Betty McIntosh, committee member.
JD.
Good evening, John Danielle Nolan, committee member.
Roberta.
Roberta Barnett, committee member.
Travis.
You.
Travis Rogers, public member, HSS. Thank you.
Dolores.
Also committee member, Dolores Rubin.
All right. And we have Nellie Gonzalez from CB4 here, and Jeremy, who is going to be presenting on our first item. Joe and I had some lengthy discussions, guys, and we are rearranging the agenda. So the first item we're going to be discussing tonight is, I forgot what it is on the original agenda, but tonight it's Jeremy Markman. He's here to discuss the Safe Staffing for Quality Care Act. It's in the legislative process with City Council, and I believe the state. He will definitely inform us more about that. It's legislation just requiring safe staffing ratios for acute care and nursing home facilities.
And Jeremy's here representing the New York State Nurses Association.
Yes, thank you. I couldn't remember where he works. And I thought noteworthy co-sponsors for, Jeremy, can you begin? I'll let you give the presentation.
We're also joined by Pete Diaz from the committee. He's in the street right now, so he's on mute. Go ahead, Jeremy. You got the floor.
Jeremy, are you there?
He's there, but he's not.
Sorry. I was having a tech problem. I just was actually texting you, Maria. I thought I had to restart my computer for some reason. I am trying to get my colleague Caitlin. She's supposed to be on. We also thought that we were going to have a nurse do this, and they thought they had a little bit of time. Can I just work on that, and maybe we can? Let me try to pull her in.
So we lost your audio for a second there. So the only thing is, if we go to our next item, we will be on it for about at least 25 minutes.
That's fine. So I will let them know that they have 25 minutes. That's fine.
Okay. All right. So then we have 2 more items on our agenda for tonight. One is we are going to, knock on wood, finish the social service checklist that we worked on for months on end. We've done a great job on. And the basic work that we're looking at tonight is just reorganization of the document. And then we're going to start the review of the affordable housing plan, which has been bumped off the agenda multiple times. And we're going to do the first portion of it, which is looking at the affordable housing plan and the changes that happened between 2019, the last time we updated it, and 2022. Oh, Jeremy is Kate. So
Caitlin is on. Caitlin, we have the ability to go first if you want to just get it through. Oh, can you unmute?
But you're on mute, Caitlin.
Hi, folks. Yeah, you know what? That we appreciate it, first of all.
Yeah.
And I think, Jeremy, maybe it does make sense to do that because
Yeah.
the nurses that we're hoping to get on are at work till basically 7:30. So
Yeah.
I don't think they can get on before then. So do you want to, I mean, are we on now?
Yes,
Yeah,
yes,
yeah.
you are. So we'll start the agenda again, kick it off, Jeremy, and we'll take it from there.
Well, so I did send Nellie, I sent a PowerPoint. Were you going to put that up or
Sure.
Or should I put it up?
Nellie can run it.
Yeah, while Nellie's doing that, I just should make a quick announcement for people who are on, public attendees. I'm getting some text messages about this. Just really quickly, I should share the agenda. The first thing is the presentation with the Mt Sinai West, the Nurse Association. Second thing is the draft social services provider checklist. Third is the affordable housing plan. And then if we have time, we'll get to old business, which is the syringe letter. I'm not sure if we're even going to do that. Joe and I had a discussion. I thought it would be great if we could. However, Joe made a great point about Katie not being here tonight. And she was the main person who worked on that letter.
Right.
Yeah. So
there we go. We got it.
So, all right. So, yeah, I mean, I'll start us off and then, I work in the political and community organizing department and I work with the Mt Sinai system. Caitlin is actually the rep that is working at Mt Sinai West with the nurses there. So we wanted to do a few things. We wanted to talk to you about, basically we got a resolution passed in, Mt Sinai Main and Mt Sinai Morningside. And so they passed that with their board. And they also, they sent a letter to the administration saying that they passed this. And also that was sent to all the electeds. And that's what we're kind of asking here today. Not so much about the resolution passed in the city council, except we utilize that to just kind of to talk about the issues at hand. Basically, this has been something that's been going on for way too long. And we even have a safe staffing a bill that was passed at the state level, but it's really, it still hasn't gone into complete effect. Even though it is in effect, it's just been kind of on hold and it's still, a lot of things are being sorted out. Basically, it was passed at the state level and what needs to be done is, they need to get together in each of the facilities all across the state, whether they're unionized or not. We're with New York State Nurses Association, by the way, so we're union. But all the hospitals individually have to go over staffing plans and submit them to the state. And it has to be done like every year. And this has just been this is not the bill that we would have wanted. We would have wanted set nurse to patient ratios. But this is a problem that's going on in all of, all across the country, in the state, and in the world. Quite honestly. The reason for this is, basically it's the for-profit system of healthcare has caused this where, they're treating healthcare just like another thing in the capitalist system. It's just another thing. It's healthcare has a price tag to it. And so they're trying to get the most amount of labor for the littlest, cost to them. And so this is really putting in jeopardy patients and the nurses, quite frankly. But it affects all of us. So basically, nurses at Mt Sinai West are at a breaking point, just like all these other facilities. Staffing is at a critically low level and morale is at an all-time low. The nurses are leaving in droves. There's an excess of 300 RN and nurse practitioner vacancies in the whole system. And this directly threatens the health and well-being of residents that Manhattan Community Board 4 serves. Caitlin, do you want to jump in on any of that?
I guess just to and thank you again, to the Community Board, Health and Safety Committee for hearing from us. I wish I had my members doing this who were, and nurses' lives are not that predictable, and they certainly are not right now. Anyway, so they're stuck on the floors. But I guess just, I think the combination of going through COVID, right? And a lot of nurses ended up leaving sort of then, but a lot didn't, right? A lot stayed. And what we would want to see from management is recognition that they worked through this crisis and they're still here, and they're working incredibly short-staffed. So, whether it's the law that's gonna help us hold them accountable, we also have our contract, which they're just not meeting the contractual commitments that they made, and in terms of numbers of nurses that are supposed to be on the units. So when Jeremy says the morale is low, it is, because what happened is a lot of the, nurses who aren't so invested in the hospital and really rooted here left often, right? They either went to take travel jobs and get paid a lot more money for a period of time, but they, a lot of them don't feel respected by the hospital, and so are willing to take other offers. So, and then just the other thing I wanted to mention, Jeremy, because she can't be here, and I wanted to follow up with you all and let you know about, I know we had come to you before about issues going on with the closing of the detox and rehabilitation unit, which was, over a year ago at this point. And for a while, that service was completely removed from the hospital. Those nurses were displaced. I'm happy to report, and I think you know this, that service is now back open at the hospital. It's not on the physical unit that it used to be on. It's on a new unit. The only issue now that we're having with the hospital with that is that we want it to be at full capacity. And right now, the whole capacity of the unit is 12. And when they were on their other unit, it was, a little over 30 patients they could take. And we think that the need is there. So we want to see, and management says they have a plan to expand where they are right now, and that the construction on their original unit has finally begun. And so possibly June or July, they'll be moving back to the original unit. And we believe then that there will be the capacity that this community deserves.
Caitlin, just a quick question. Normally, at Mt Sinai West, what are the normal number of nurse practitioner vacancies?
Nurse practitioner vacancies.
Well, no, either RN or NP. Just the idea, like the normal number of. I know there's always a shortage of nurses, but it's normally not 300. I'm expecting. What is it normally?
Yeah, but it's well over 150 at. That's combining Morningside and West together.
Historically, it's over 150. Now it's.
Historically, that's a way more vacancies than historically. I think probably pre-COVID. I'm doing my best to guess, but there were probably about 30 new hires a month. And some position, and that mostly filled positions, some left sitting vacant, but now we're seeing these, positions just sitting there it's kind of a never ending sieve, because they are hiring new people, and I will give them credit for that. But the issue is, one, new nurses are scared to stay here because it's really, the conditions that they're working in are not good. And so people come and people leave, but so where we have 150 vacancies now at Morningside and West, prior to COVID, the regular amount would have been much closer to 40, 50.
Got it.
Yeah.
But also the retention is a huge issue, and and basically there's very little retention. They're not doing stuff that is creating a morale and dignity for people to want to stay. then the new people are thrown right into this environment where they're not able to where they're like, screw this, I'm out of here. You know, they're not being trained properly. I mean, and just so you know, the big departments that are really, I mean, all the departments units are affected, but it's ICU, ED,
And L&D.
and L&D.
Yep.
And so, you know, I mean, this is a big crisis. And it's just important for the community to be aware, because I mean, I'll tell you, like, I don't want to go into like a hospital with this setting, despite the fact that the nurses are doing their most wonderful job that they can. I will know that while I'm in there, that, you know, they are short-staffed. And also if I had a loved one have to go into the hospital, I mean, you just don't have enough time to spend with each patient.
So given the fact that the hospital is understaffed and they are doing hiring, you said the root causes are a lack of both retention of staff that's there, because you have a revolving door, so it means that it keeps on dropping, but also there's a difficulty in recruiting, because all I keep hearing the anecdotal evidence that folks are coming from all over the world to come try to work or trying to get things approved to work here, because there's just not enough nursing staff in the country. Is that inaccurate?
Well, Caitlin, I'll let you go. I'll let you do that.
Yeah, no, I think we totally acknowledge that. Yes, that's a problem that is every hospital is facing, and you know, in most corners of our country, I believe, and New York especially. What Sinai is not doing so one example is out of an acknowledgement of how bad the staffing is, and the fact that they were, you know, the hospital had to be willing to pay travel nurses, you know, exorbitant amounts of money to do the same job as our members. The other one thing, so anyway, nurses were really resistant to doing overtime. They're exhausted, they're working incredibly short, you know, so management agreed to do an overtime incentive where nurses who were willing to do overtime shifts got compensated more. And management stopped that. They ended that about a month ago without any demonstrable improvement in the staffing that led them to make the decision initially to do this overtime incentive. So that's one example of something Mt Sinai could do to make it different. I think Mt Sinai and Morningside and West specifically, we believe they're being pretty punitive with discipline that's really unnecessary. That's, you know, they talk a lot about just culture. I'm here right now and I'm looking around and, you know, you see it everywhere, just culture. And to us, just culture would mean something like, if there's a medication error that a nurse self-reports, right? That the default isn't discipline. The default is what happened. How can we figure out what's wrong here, and addressing systemic issues rather than punishing individual nurses, which obviously has to happen sometimes, but we think it's happening too much here. I feel like I'm getting a little off track of what's the...
Dolores from the committee has her hand up. Go ahead, Dolores.
So first I want to say there's probably no one who wouldn't say how much nurses are appreciated, and especially how important Mt Sinai West is. We very much care that there's adequate staffing for the community. However, as Joe mentioned, we're hearing anecdotal comments. There is a shift in the entire industry. Caitlin, you did mention the traveling nurses. That has really created a problem across this entire country. I personally feel a little uncomfortable for this committee to be taking a position without having the opportunity to have the conversation with Mt Sinai West, understand the full scope of some of the responses they may have or concerns. I just think that we understand how the nurses feel. We understand the stories you're telling us, but for us to take a position without having that other information is actually irresponsible. So I just wanted to be on record.
I also wanted to know, I would like to get some specific things that we can meet with Mt Sinai about to try to address, because we know this problem is not going to get resolved in a heartbeat at all. So we want to get like specific asks. Roberta, you're up.
Thank you. Appreciate the presentation. I was curious your opinion as to what elements that are creating these issues with recruitment and retention are specific to Mount Sinai and what are perhaps more industry-wide at this point. I mentioned that specifically because, as Joe mentioned, there are probably asks that we can take to Mount Sinai, and there are probably asks that are,
right,
systemic within society at this point.
That we can't change the entire U.S., right?
As much as I wish.
Yeah.
Yeah.
Jeremy?
Jeremy, you want to go ahead, Jeremy?
I was going to say, no, I think that it would be great to ask Mount Sinai to come and to do a hearing and to speak and to kind of let us know and get an insight into what they're doing. I mean, the way that our nurses have felt and our members in terms of meeting with the executive committee and negotiating contracts and stuff, and this has been for a very long time, and this has gotten even worse because of the staffing issue, is, they're not doing everything that they need to do to retain nurses, to train nurses. They'd rather have people come in through these, traveling nurses or whatnot, or they rather pay when, they could pay our nurses a little bit more in order to retain them. And so this system there's been a system in place that they've created. And, quite frankly, I don't think that they're doing everything that they can do to hire more nurses. But at the same time, it's a constantly rotating door because they're not doing enough to retain the nurses. So there's a kind of a lack of respect. And, I've spoken to people on Mount Sinai before where the line is like, oh, everything, in the administration, everything's great. I was on an advisory board and all I heard was, everything's great. But I knew on my end of working for NISNA that wasn't the case. So, you speak to people like Brad Corn and whatever, and they'll, oh, we treat everybody wonderfully, and it's not that's not the case.
I'm just trying to bring the discussion down to concrete actions we can take. So think about that. I'm going to go to Maria and then JD, followed by Leslie. Maria, yeah.
I have a few questions and a few comments. Jeremy, I heard you mention it was passed on the state level, but just a portion of it, correct?
Yeah, it wasn't passed, and it wasn't the full. It
Right.
was a very big step, but it wasn't to the. We would rather not have to do this every year in every facility, and present. We would want to set nurse to patient ratio. Yeah.
And the co-sponsors were Gottfried and Rosenthal.
I
I did a little research, and that's what it looks like.
I think it was Gunther and Aileen Gunther did it in the assembly.
Gunther?
And in the Senate, I think it might have been. Huh?
No, I'm just writing it down. I'm sorry.
No, it wasn't Gustavo Rivera, was it? No.
Well, you can get us the information.
Yeah. I'll get the information.
Yeah, that would be helpful. Thank you. And then the safe staffing, when you're talking about safe staffing, you mean more than just RNs, more than just nurses, correct? What other roles does that mean?
So it gets a little tricky. So one thing the law says is that if there's already a staffing plan that exists, that it requires every hospital to create a staffing plan with management and unions working in conjunction, and that's all unions at the hospital. Or if it's a hospital that doesn't have labor representation, that's supposed to be equal members, staff and managers. And part of the law says that each hospital has to create a staffing plan. Now, many hospitals already have a staffing plan. And really what we're asking for in terms of what we want, we're not asking for Mount Sinai anything more than what's already in our contract. It's just they're not meeting them, and they know they're not meeting them. And so we want to see them do everything they can to change that.
They're not meeting the patient-nurse ratios. Is that what you're saying?
Yeah, so ours aren't exactly ratios, but it says it basically comes down to that. It's our contract staffing language says things like on a psych unit, if there's 35 patients, there should be, I think it's 7 nurses, right? So it's 1 to 5. And instead there's often, 35 patients and 5 nurses.
All right. So in other words, irrespective of it says ratio, it is a ratio.
It is.
Depending upon the type of unit.
Yes.
Okay.
And really what we want the hospital to do is to respect those numbers that we have already agreed to. And in terms of other staff, we've always had an issue because our contract has in it, here's how many nurses should be on in this particular unit. Here's how many PCAs, for example, should be there. There's so many techs should be here, but
personal care assistants.
Yes.
Okay. Thank you.
Try to avoid the jargon so the committee understands.
Yeah. So basically, other support staff, our contract at Morningside West does say that. But we're hoping at least the staffing bill, one thing that will come out of it is we're going to be able to work closer with 1199 in terms of, we've always kind of run into a wall with management when we talk to them about the need for additional support staff who are not necessarily NISNA members. We kind of get shut down by management. They say that's a different union.
Sorry, can I just jump in? So, because I have another question and and just because thinking about the other items we have on the agenda, do you know what the current ratios are? And I'm not asking it necessarily about Mt Sinai West. I'm just curious, like in a general kind of way. And what is the request of the patient to nurse ratio in this Quality of Care Act? If it's in there at all specific.
My understanding is what we wanted to see that. And instead, I believe the only units where the state actually said, here's the number that it should be is ICU. Is that right, Jeremy? Where it should be 2 patients to 1 nurse. And other than that, there's professional associations, obviously, that have recommendations. But, what we have here, it's like, it depends on what kind of unit it is, from having, up to 1 patient. If it's like a brand new, fresh heart, that's a 1-to-1 assignment. ICU is 2-to-1. Med surge kind of regular units are generally 1-to-6. If they have telemetry, which is monitoring hearts, it should go down to 1-to-4. And so we have that.
I think one of the things is that tonight your presentation is a little bit diffuse, and we need to understand and send to us what specifically are the contractual requirements, because that's what we're talking about. Mt Sinai West and Morningside, right? We're talking about those. That's our hospital. That would help us understand it. And then we can also, as Dolores said, just try to book a meeting with Mt Sinai to come in to discuss this, because if it's a variance from what's agreed to, it means it's a problem with patient care and therefore our neighborhood. So I'm trying to just reduce it down to get it, because when you use words like respect, I understand this in terms of the union back and forth, but for the community board to understand and how to deliver an assistance, we need to be very specific. I'm going to go to JD and then Leslie.
I agree with Dolores and everybody probably on this committee. Nurses are fantastic and I would support them as much as I can, but I'm a little concerned that I don't understand what is being brought to us. This is the Nurses Association that has some proposed legislation before the state. And we're supposed to be involved because Mt Sinai will be involved in this. I don't understand what we're being asked to do. We're not a labor relation board. We don't have the full story, at least I don't. I'm sure everything you're saying is true to your lights, but where is the other side? Where is the statistics? I don't know. So Maria, why are we being brought this? What are we being asked to do?
But Jeremy, hold on a second, because that's exactly it. I think I think there's a kernel of concern here, and it's our role to respond. However, the clarity presentation is missing. I want to say that again.
Okay, yeah, and we can certainly arrange for next time to get the more concrete numbers for you. Just to answer Maria real quick, it was Gustavo Rivera is the Senate and Gunther was on the Assembly side. Gottfried had been involved for a long time, but it ended up being Gunther. And so that's passed. But yes, what we're doing is we're coming to the community as patients, because all of you will end up, all of us are going to end up in a hospital at some time. Patients who are going to go into the hospital and don't want hospitals to be functioning in this way. And what's happening is Mt Sinai is not negotiating in the best faith with our members, and they have not adhered to things that they have said, and they have not been a good employer. So is it a national relations board? I mean, you can try to do that as the best you can, but our job is also to have rallies, to get the community involved, to get community involvement, to have the community push their hospitals that are affecting them and their community to get better treatment all around. Because if we don't say anything, it's just going to continue to get worse. We can press it in other levers, but we're trying to press it on all different factions. So we're also going to meet with the electeds. I mean, we have all the support of all the electeds who are who represent their area, and we will continue to have meetings with them on this. So I'm sorry that this is not as concrete as you would want. As I said, they did pass it at Mt Sinai, Maine. They did pass it out at Morningside. And, this is known to be a very, very critical, big issue. They're not doing enough of what they need to be doing to retain nurses.
Right. Again, I just want to say in the language that's being presented here, it is not about a labor negotiation. There was an assembly and state bill passed specifically about staffing. The request was a slightly different bill that would have set nurse-patient ratios. That did not pass. Another bill did pass. There is still a problem with nurse-patient ratios, as you've evidenced here, but we need the details in order to be able to get to the hospital to say, we'd like you to explain and assist here to make sure we deliver better patient care. So part of it is when you come back again, it's not just the labor thing. For us, it's the service. We understand the labor part, but it's the service too. And that's what will get the community behind you. Leslie, and then Travis.
And then I want to jump in also, Joe.
Yeah.
After Travis.
You can close up, Maria, as soon as I have to bring this to a close. Leslie.
Yes, thank you, Joe. Jeremy, thank you for the presentation, and we all agree that nurses are indispensable. My question has to do with the contract and where you are in terms of the contract. Are you in the midst of contract negotiations? Is that where we are?
I can jump in on this. The contract expires at the end of this calendar year. And so we're just starting to do sort of building on the union side, building our bargaining committees, surveying our members. But that's the contract will certainly be at the table before the end of December. And we're thinking probably actually start bargaining in early fall.
Thank you.
Thank you. Anything else, Leslie?
No, that's it.
Travis, you had a word?
My question was asked and answered.
Got it. Maria, you have the last word on this. You can bring us home on
it. Yes, and then we'll go into my favorite thing, the social services checklist. I guess, what's on my mind is that I did hear Dolores say she's not comfortable in us supporting this at this time. And I actually felt uncomfortable with hearing that, because I think this is something important. However, I must admit, I was a little confused. I thought this presentation was going to be about supporting the legislation, but it sounds like what's happening is it's really about like Mt Sinai West and us having to have some sort of meeting with them is what it sounds like to me, which is what Joe is saying. And, the other thing that I think is important just to note, I heard, I don't know who mentioned it, but it came up about, yes, we understand that this issue about nurses is happening everywhere across the country. I think, but whenever we have these meetings, it's really about what's happening in our community and in our city. And I think if it's happening and it's impacting our residents, our family, and our friends, which it is. I know people personally who are being impacted by this issue and having to hear stories about it, as well as that I work in the Ryan Network. So I see the impact of this on staff. I know someone who was a nurse who took her own life, and part of it was all of that she was enduring during COVID and Anyway, I'm going off. My point is that I agree with, thank you, Joe, bring me back. I agree with what Joe is saying. And I think us having a meeting it sounds like that is maybe the next step. And
can I make a motion?
Come back.
I'm
sorry,
waiting.
Dolores.
I was waiting, Dolores.
I would like to finish my sentence, Dolores.
Oh, go ahead, Maria.
Thank you. And also, at the end, I was just going to say, I think having you guys come back, like Joe suggested, would be a great idea. Thank you.
And so,
Dolores, you were going to make a motion.
Yes, I'd like to make a motion to have the staff, have our staff from the board invite Mount Sinai to come and provide us some more details. And what I would say is to the nurses union, again, our nitpickiness is not about you. It's about, we really need to understand what the ask is. So no one's against being for better conditions, et cetera. Obviously, we all may need these services. It's about we're not understanding what you're asking. Right. Yeah, we're not understanding what you're asking. It's not a clear, clear-cut picture, and it's going to be helpful to your members as well.
And so, I use the example when you came to us about the psych unit. It was clear, we understood it. We went to 17 meetings about it, and we've made some progress on it.
Yes.
Right? So, because it was specific, the more specifics you give us, the better we can function on behalf of getting the patients better service. So, thank you. So Dolores made a motion. Is there a second? Second by Leslie. All those in favor, please raise your hand. All those opposed? All abstaining? All present and not eligible. Okay. Thank you so much for tonight, and we'll all do better next time, Jeremy and Kate. Don't worry.
No, I'll work with Nellie on getting back on the agenda. And so much. Thank you, really. We appreciate.
Thanks so much. Yes, we do.
Thanks, everybody.
Okay. Bye-bye.
So we're going to move next to the social service checklist. I will put it up, Nellie, because I have it set up ready. So I knew in case you were not here, that was my concern. Can everybody see the document? First, I just want to know, I'll stop the share for 1 second. Did everyone receive the document and was able to look at it in the Dropbox? Is that a yes, no, maybe? Roberta looks perplexed.
Let's see.
Sorry, I had an older version of the Dropbox downloaded, but I'm pretty sure it's there with the new one. So
okay, yes. Just want to make sure, just give me the sense of it. Give me a head nod. Everyone has at least been able to see the new one? Yes? Perfect. Okay. Put it back up. So first we have a simple cover paragraph, which is going to go to the full board after we adopt this. And this just explains to the board members what we've done as a committee. Very simple, and just saying it's being presented to them. Then we have an introduction. And this I'd like to spend a little bit of time on because a lot of the stuff we've looked at, the intro we had done some review on, if we can just give it a look for a moment. I think this is the tone setting piece, and everything else we can sort of work on easily through the process. So if we can look at it, and let's first talk about this first section, which is lines 24 to 30. And if you want to raise your hand, because we can't do the hand raise, I can see you easier if you need to do that. Just raise your physical hand.
You're just looking for us to comment line by line?
Yes. So in other words, if there's anything in terms of the tone in this section, Dolores, that does not speak.
Yeah, this very much mirrors, language we've used in our statement of district needs. Providing, as you said, setting the tone for what type of neighborhood this is and why we believe it's important for people to understand who we are to make this ask in the checklist. So, I mean, the language actually sounds like it comes from one of our statement of district needs, so it's fine.
Yeah. My real focus when I worked with Maria on this the last couple of weeks was to get the idea that the reason we're doing this is about better integration and understanding and acceptance. That was a big thing. Like, we're not just asking questions out of nowhere. JD, and then Betty. You're on mute, JD.
I'm so sorry. This is picky, but this is so great. I just want to be picky for a second. That second sentence, the success of that integration has been achieved through communication and discussion. Those are basically the same thing. I would say through communication and cooperation.
Gotcha.
I would emphasize it's not only that we're talking, but that we're working together, something like that.
Mhm. Betty, and you're not on mute.
No, I think it's a very good paragraph. Just a picky little edit on line
no,
29.
Give me the edits later.
Oh, you don't want even a little picky thing?
No, your edits are perfect. Just write them up and send them. They're easy to do that way. I really want to focus on substance tonight.
Oh, okay.
Anyway,
I was,
It's a good paragraph.
How about the
Joe-
next paragraph? Sorry,
Joe,
Maria, yes,
Joe, if you need me to, I can take notes while people are making their suggestions.
that'd be great. Remember,
Okay.
we're also recorded, which helps.
Okay, yes, true.
The next paragraph, any questions or
Sorry.
comments on that?
I'm so sorry. Can I
Oh,
add
Roberta,
something to that first paragraph? I know that this is very silly, but where it says the different groups and inclusion of block associations, community organizations, is individual residents or just resident feedback at all useful?
oh yeah, yes, perfect. And by the way, understand, community members, we will have missed things having looked at this so many times. So that is what really we're looking for, a bunch of more eyes on this. Got it. The second paragraph. JD? You're on mute. You're on mute.
You have an extra such after, I think it's a third sentence, second or third. Such projects may be for homeless services, such drop-in centers. Take out the second such. This one.
Got it. Yep. Again, you can get blind doing this over and over. Any other comments on the second paragraph?
It's good. I just think that maybe we just noodle on offline if we're missing
Sure.
any type of social service. But it seems like we've got most of the categories here.
If anybody thinks after this meeting that we've missed something, we'll send it in and like, put it in.
Thinking something like kids, childcare, after school program, that kind of thing. But I'm
Right.
happy to email.
So shoot that in an email. So we can get it on
Yeah,
there.
will do. Thank you.
The
Who
third
said-
paragraph. We're getting feedback from somebody, so
I think it may be, yeah.
okay.
I have a
Third
quick
paragraph.
question about that second paragraph.
Yes.
So where it says the checklist to provide and clarify presentation of information from social service providers proposing new projects. Is that the express purpose of the checklist, or is it just to guide? And
It is some organization coming with a service, and by which you say new, maybe new or expanded, that we have not dealt with before. So let's say Hudson Guild wanted to come and open up an early childhood, a childcare center in a different part of the neighborhood entirely. We would ask them to fill this out. So we understood, what is it? What does that mean? Who is it serving? Or let's say Urban Pathways wants to come and open up a drop-in center on 9th Avenue, like we've had. We would have gotten this to understand what exactly is the scope of work, the program, and what does it mean in advance. It's really trying to act as an early warning system.
no, so I asked that question because when you say guide and clarify presentation of information, I think it's just to guide the social service providers. I think when you say guide and clarify presentation, I take that as a presenter, I take that as, okay, this is to get me through the presentation, not necessarily things I need to uphold going forward.
I was trying not to say that we're going to guide the providers at all, because they should present what they want to present, but at least we should have the information in a consumable, understandable, and consistent manner. That's been one of the problems. like the group that comes and doesn't talk AMIs or doesn't talk like they're all talking different languages.
Yeah.
And they're all over the mark. So someone can come with a crazy idea, let's say, and that's okay, as long as we understand what it's about. Because we may, as a part of this, agree, disagree, or ask to modify, right? But I would hate to foreclose something. I hate to say we're guiding them on how to provide services.
So Travis brings up a good point, and so I'm wondering if possibly the sentence just structured a little bit differently. Provider checklist.
It's almost a level set, Dolores. Or
yeah, to be a guide of our expectations. That's exactly what I was going to say. So, to provide a guide of Manhattan Community District 4's expectations for social services. So, I mean, maybe it's just the structure of the sentence, because that word presentation, I think, Travis, you're right. It could be confused about whether or not it's just coming to the board or to the committee. That's all.
Yeah.
I'm going to just highlight this. I think I got the idea. We need to word it in a way. I want to make sure, Travis, it's not about that we're directing so much.
Yeah.
At the same time, but maybe it's somewhere between presentation and direction. And that.
Yeah, no, I get that, Joe. I just been on presentation teams where, like, if we read this, it would just be what we present to, but it wouldn't be with the expectations. We'd have offline conversations about the actual expectations.
Sure.
Yeah.
Other thoughts from the committee on the third paragraph? Okay, so moving to the next sections, we decided at our last meeting we would make these questions. Who needs to complete it? When should this be submitted? And how is it submitted? I think this reflects our discussions from our last meeting. Okay, hearing no comments, we'll move on. Yes, a general nod, this makes sense, okay? Then here's the major thing we spent a lot of time on was the reorganization of the document itself. It's broken into 5 sections: organizational overview, information just about the organization proposing, not about the project, just the organization. Then the proposed program description. And we realized a program is not necessarily residential, but a program is always going to be in a building or a site. So it could just be an after-school program, for example. It'll be in a building or leasing a building. And then if it's residential, that's if applicable. In the last section, we sort of grouped things together was about community notification and communication. So instead of having this being the provider repeating things, we get them in sections at a time, and hopefully they do them once, except for residential, they have to do some more detail. So this first section is merely just who they are, who's the contact person, the organizational history or a link to their webpage that tells us what it is, social services provided by them in general. They're going to attach, we ask them to attach an organizational staff chart, because many times we never know exactly from some organization who we're talking to or how it's being presented and how this fits into the whole organization. And most not-for-profits like this, who are constantly dealing with city or state or federal contracts, they have these documents at hand. It's not like they have to come up with them at all. And then the next thing is affiliates and subsidiaries. Sometimes a not-for-profit has a parent corporation and then multiple different entities that it works with. It might have like a subsidiary for-profit or affiliates that own a piece of property that are also not-for-profits. Just so we understand again, what is the scope? Similar to our discussion we had with Housing Works of understanding how they work together. If they had given this up front, we would have understood a little bit better. Here is the things that here are the entities that they control, here's what they manage, that kind of stuff. So we have a better idea. And then we get specifically to asking, have they ever worked in our community? A yes or a no. If they have, please provide this. If there's not enough space, they add an appendix. These will all be lettered differently. And then what is their history in the district? And again, they can add more to give us more information. You then come down to the proposed program description. And here is what we did the final editing of the document. We realized if the program is residential or just a service program, it's still a program. So we asked them what is the program type? And Roberta, here is where we should add in more boxes to check, because we really realized that these two are two buckets, homeless services or other social services. So I think that's a good thing to like lay out. And by the way, if we miss a checkbox initially and we find it, we'll edit it and put the form in, going forward. It's a living document. And then we ask, what is the program description? Now we're talking about the program proposed, not the organization. And I think this should just be a short section because it will force people to clearly and easily say, here's what we want to do. So it's got to be concise. The proposed program start date, and then proposed funding sources. And also, Roberta, maybe you and Travis could help. This might be a chart that's a little bit more columns with more information. You really want to get an idea of like, where is it? Where are they funding from? I just did this quickly today because I realized the chart's better for us than just narrative information.
Do you want to add period, like time?
Yeah, exactly. Yeah. Well, see, I wrote contractor grant term.
Okay. Oh, okay. I didn't even.
But whatever. I think.
That works.
Any thoughts? Any thoughts the two of you can give to this would be very helpful. Okay.
I actually lost it off the screen. So where's
the share? Can everybody see it?
Yeah, I got it. It's got it. Okay. Yeah. So
came back.
Mm-hmm.
And then we have staffing plan. Now we're talking about the program staffing, not the organization chart. And that's what we asked for, and general stuff, full-time employees, part-time, total employees, full-time employees, staff, consultants, supervisors, the client ratio, the case manager ratio, staffing qualifications. These are licenses or certifications required that we put in a couple of meetings ago. Supervision and training, how often will they meet?
Oh, you have a couple hands up.
Oh, I'm sorry, didn't see him. Go ahead. JD. And then
sorry, quick clarification. Joe, Maria, what's the difference between a drop-in center and a safe haven?
Drop-in center is people drop in for the day. They may be able to sit in the chair and sleep overnight. A safe haven is kind of like transitional residence. So you can come in with very few rules and stay there for a period of time.
Yeah. And Leslie?
Yeah, I have a quick question. I'm not sure how this fits in, but the question I'm thinking about is, would there be any circumstance where providers provide service externally, meaning in a park or such in the community?
That's actually something that happens. They do homeless outreach, and we should add that as a category. And then we should say, what is the catchment area for the outreach? You're right about that.
Oh, that's good. Yeah. Something, Joe, I was looking at my notes from back in December when, and Roberta, I don't know if this is in here. Roberta actually had mentioned it back in December. I don't know if we still have it. If the provider owns or leases the facility.
Yes, coming later.
We do? Okay.
Yeah. It's in the site section.
Do we all?
We're still in the program section here. So
you're
all
looking
of
at the
this
program
is
section. Okay.
This is all about program description still. We haven't gotten
ahead.
to the actual site. So go ahead, Maria. More questions on this, on the program side here?
No. Thank you.
So then staffing qualifications, supervision and training, describe client eligibility or entry criteria. We have no idea what that may mean, how someone comes into a facility or comes into a program. And then experience in serving the target population. We've talked about them as an organization, the whole. Now it's, have they done this kind of program somewhere else before? And these are all the questions we put together, I would say 2 meetings ago. Strengths and limitations, metrics for success and performance, and then experience with community engagement. And have they worked with any other community boards? And then collaboration. What do you do? How do you connect with people in the neighborhood? How do you manage this? Describe the collaborations they've had. Other projects, how they resolve community and neighbor issues. That was a question we came up with a couple of meetings ago. And then what is their complaint mitigation and conflict resolution strategy? Also remember, all the numbers are off in this thing, so we're going to fix that at the end. And then there was a question about frequency of intervention by medical or law enforcement. And that brought us then into the program section. So are there any program questions that we've missed? Sabrina, Roberta? No?
I have a question, but it's more about the whole document itself. Like, what happens if when they present it and have all this document filled out, do we not hear them out? Do we?
No, I think we work similar to what happens with BLP.
Yeah, because I was thinking about BLP actually, because
yeah, like we would say, like the office would call them and say, we submitted this document, however, you're missing some section.
Later, yes.
Do you misunderstand something? Like, I think this, like with BLP, this is back and forth, you know. So we want to assist the provider to get information
as much as we can. Yeah.
Right.
So also, like, I know that for BLP, because I was part of that committee at some point, and there were things like, well, we suggest you to do such and such and such, or if they don't know or they haven't thought about it, whatever, for whatever reason. So I think it could be also like that, like some sort of a guidance, and then you can provide this information in a later time.
Yeah, exactly. I mean, part of this is getting as much information as possible, and then, or how about if they submit something and it's not quite accurate, or it doesn't answer the question, we're gonna have a back and forth with them in actual meeting.
So to Sabrina's point, Joe, Sabrina, I think that the nature of what the questions we're asking in and of itself provides some guidance. So if we're asking, have you actually had this type of programming before? If an organization has it, they may say, oh, wait a second, this is a community that has experience, and maybe we need to consult with other folks that may have done this type of thing. So that's the beauty of this document, Joe, Maria, great job.
Yeah, there may be questions that they never even thought to answer. It's like, yes, how many security people do you have? We need to know that. Now, I will say honestly, if people are seeking funding contracts, a lot of this information is already in what they're thinking about submitting to a funder. So it's not like we're asking them brand new ideas for a not-for-profit. Next section, proposed site and building description, location and zoning, what kind of district, doesn't require any zoning action, does comply. And then the project summary, a list of things here. And here's Maria, where we talked about, is it leased, is it owned, what do they acquire? We'll build this table out a little bit more to get more information. But these are the specifics about the site. And is it new construction?
Oh yes, that's where it was moved to. Thank you.
Yes. Or is it new construction or renovation? And then a very simple thing, please provide plans for renovation or construction of the program space and attach. If BLP can get a set of plans that show where the bars are and where the tables are, I think we can get from a social service provider what they plan to do in a facility. Yes, JD. On mute.
You're on mute.
You're on mute.
Sorry, Joe, could you go back to the top of that? It says location and zoning. Location and zoning, but this is just about zoning. Is that correct? It's really.
You know something, I'll tell you what dropped out of here, JD, is the address.
There you go. Thanks, Joe.
Whole thing dropped out with the address section. Yep. Okay, because of that cross streets, everything. All that stuff fell out, Maria, when it was moved around. Thank you, JD. Project type, plans, and then surrounding area. Here's where we ask them, what's around this proposed facility or program? You tell us, and then we give them some links to say, go look on our website to find things. But it's up to them to find out what it is. We don't want people to say, we don't know. Now, if it's a residential program, what's the square feet, the units, number of residents? We'll drop in a table here too that just sort of says, here's the AMI bands, here's what it is. So it's very specific, like we do from inclusionary housing. We'll pull this reference in one of our inclusionary housing letters and just drop it in here. Provide stacking of floor plans. That's Appendix XX, as those have to be remembered. Is there any tenant relocation? We've had a few cases where, like in Pete's building, someone, Urban Pathways, came into an occupied building. And we want to know what's happening with the tenants who are in that building, the long-term tenants. And then a list of amenities and program spaces. And we made a fairly comprehensive list. We'll review it carefully, make sure we have no duplication here. But again, it's about, and I'll probably group it into like outdoor spaces and things like that.
Okay.
So we want to know what is being offered. Betty.
If it's a support facility for affordable housing or homeless people or whatever,
Mhm.
within a market rate building, is that able to be clarified on this chart?
These are basically social service programs. And social service programs might be a residential program. We have not really seen them in market rate buildings ever.
Never. Oh, never.
No, that has run our inclusionary stuff. That
Okay.
the inclusionary housing units are market rate buildings, which we have our separate, checklist.
Okay.
So again, feel free to add on things that we may have missed here. Because this originally was kind of written more like it was inclusionary housing, and that's not what this should be. It should be about very amenities that can be in some sort of social service facility. Describe the tenant selection process if it's residential. Describe the tenant orientation process we had asked for. And then now specific social services that are offered in a residential setting, which is different than a regular social support thing. Betty, you have another question?
No, I'm taking my hand down.
Okay. And then we go down to additional services, if they're not noted above. Additional descriptions about services provided virtually. That was a discussion that we had saying it's not just services at the site, the services that could be brought to the site virtually. Describing COVID protocols, security staff, any on-site assistance with vocational training. We'll probably collapse that into the services above. In the last section, community notification and communication, that they agree to send this notification about their proposed social service program. They check the box to all these folks, and that's a clickable link. And then will they meet quarterly with block associations, business residents, business owners, and how and when can the community board get notified? And then a 24/7 contact information. And at the end, they will sign it. And if there's a building owner, it will write, if applicable, they will also sign. JD.
This is terrific, Maria, Joe, everybody, really terrific. There was one discussion also about a provider. Are they working with other social services in the area? And is there a cross-pollination? I think we had discussed that.
Yeah.
Yeah, it's in here.
It's in here. It's up. Yeah, it's up in the program section where we said surrounding area. Where we go.
No, I think JD was referencing, we had a question in terms of if the provider was collaborating with other nonprofits in the community.
Right.
I thought that's what JD was referencing.
That's right, because they may have.
Here it is, JD.
I'm coming from another social provider into their organization.
Right. Yeah, so it's B.
It is, again, these letters are off, but it's under community engagement. And it specifically says, describe collaborations with other community agencies, offsite services. What we tried to do is get these things in a logical spot. We as a committee were very thoughtful and vocal, but we had a bunch of scrambled eggs. And it was sort of having to get the eggs unscrambled to be a little clearer for consumption.
Joe and Maria, this looks like a beautiful omelet. So, but I think the key, Joe, you said it before, this, like all of our checklists are living documents. And I think that as we start to implement it, we'll find where it needs to get tweaked.
Exactly.
But I think after months, I think that, to me, it seems like we've covered everything. And it's really great. You guys did a great job.
JD?
Yeah, I agree. I'm going to suggest that Betty and I, as a former editor, go over this thing.
Yes.
capitalized that should not be, and this is important that we come across as the great organization, the
That would
committee.
be good.
I would ask though that you defer that until Savannah has one last pass on just getting the numbering corrected, because when you move things around, they don't track properly. And then we'll send it to you to do that true, serious, in this case, Betty and JD, be picayune, please, because it's going to live for a while. Is there a motion to refer this to the full board for adoption?
Please.
I move.
JD moves, so JD is seconding. Okay.
Joe, should we send this out to committee before full
Oh
board?
yes, no, this is going to go back to committee before. Everyone's going to have one last go at the wording or little bits and pieces here.
Yeah, we'll email it.
Yeah, we'll email it. We'll email next week, but I want to say, number one, thank everybody. This has been a serious collaborative effort. I think this is going to help us in engaging with social service providers. And I think it's going to make them think too, not just sort of say something, get it down clearly so we understand what it is. And it's going to help our community board ask much more informed questions, understand what the programs are. Because the truth is, we deal with a lot of good programs, but sometimes the providers are not the most together. And this helps us separate the wheat from the chaff. So can everybody who in favor, please raise your hand so I can see it. All those opposed? All those abstaining? All those present not eligible. Perfect. It will go to the May meeting and you'll get it next week to give a final look at.
Betty, thank you for all your text message edits.
All right, so now we're going to go on to another policy matter, and that's the affordable housing plan. So before I put it up, I just want to talk about the approach we're going to take. This is a big plan. It's it's over 100 pages. We're not doing it all at once. We're going to do it in 2 meetings, I think. And part of it will be just tonight looking at 2 presentations. One is they sort of simplified, here's where we were in 2019, because we were doing an update in 2020, and I guess we got busy in 2020 and weren't able to touch this at all. So it's really 2 years of work. And then we're going to look at a more detailed version just on the first sections. And the first sections are projects that have been completed, projects that are in construction, projects that are in the public approval process, public review, finished public review. Here's all the things that have happened so we can update what's happened in the last 2 years. At our next meeting, we are going to look very specifically at the sort of zoning and the more macro things in the second part of the plan. And I really want people to think tonight, look at the plan, it's online, on things we want to think about or change. So for example, our council member has said we should be looking at the block that Con Ed owns between 28th and 29th, between 11th and 12th. Good idea, as something to look at. Since we wrote this plan, it is clear now the Empire State Development Corporation has control of 450 West 41st, the old CUNY Voorhees site between 41st and 40th, 9th to 10th, more toward 10th, just by Covenant House, a big blue brick building. So we're going to have a discussion with them about that. There's a question, a Bayview is open again. Should we put that in the plan? So these are the bigger things for our next meeting to discuss and really start to propose changes in those areas. But tonight, it's first reviewing what's happened and where the various projects have moved across and new ones that have come in. So I'm going to put up the simple version first. Which I don't seem to have. Hold on a second. Let me just close some. I have too many things open. Okay. No, that's not the right one.
While you're pulling this up, I'm newer. Would you mind answering a process question?
Sure.
How is it that you go about compiling the information year one, and then two, when it comes to zoning recommendations, what is the process by which you receive recommendations?
Yeah. So this effort began in 2015 after Mayor de Blasio was elected, and it really was an effort of this committee that started to sit around and say, let's sit around. We said, what can we do to get to this new mayor recommendations to increase affordable housing? And we did a lot of, honestly, Roberta, was trial and error, like figuring out what can be done or not done. And we focused on what's being built, how is the current zoning working on producing inclusionary housing or other things. And then committee members would come and say, oh, we should look at Hudson Yards, for example. Can we get more residential zoning as opposed to less commercial? We had the onslaught coming to us of Hudson River Park zoning. And they proposed all these blocks, which would have eliminated inclusionary, but only the park to be transfer development rights. So that was something the board was dealing with in its land use committees, and then incorporate that into the plan. There's a lot of sort of whatever was percolating in the board and the community, then came together in the plan as an overview, because we have been dealing with this, certain things were like Betty, block 675, right? That was, you're on mute though.
Yes, block 675, yes.
Right, like that was something that we sort of discussed as a possibility of extension of the West Chelsea zoning, special zoning district, and then actually got picked up by developers. So we were lucky we sort of had something in there to push and guide. So it was a kind of back and forth from the land use committees to just things that were being thrown at us, from the broader public.
Joe, but I recall before when we finally posted it on our website, you had actually just initiated saying, let's take stock of what's
Yes.
here.
Yes.
And in not just taking the stock, but really describing what type of housing that is, what's 421A in the area, what actually was voluntary affordable housing. And then I think that while the first version, if I recall, while we're in the middle of it, there were opportunities, as you were just saying. So we just defined what it is we envisioned there. So for example, slaughterhouse was something that was identified for 100% affordable, recognizing that there could be a subsidy there, that type of thing. So it's a vision statement, so to speak, and an inventory.
Right, and I would say, for example, we had a lot of tenant groups come to us about 421A, and HCC came to us. And so therefore we have a whole section about 421A expiring. Like we really, it became like the compendium of the board's efforts in many areas. And then we refined it until it became more readable and usable. Is that helpful, Roberta?
Super helpful, thank you.
Okay. So now I will put up the one that says, if this is the comparison, which is the quick and dirty version of it. Okay. Here we are. And this is a map that shows us very simply, because they will be able to have details when we get there, of all the affordable housing and things and the stages things went through 2015 to 2016 and 2017 to 2019. Here's the map for the subsequent period, 2020 to 2021. That means nothing until you look at it in context of the plan, obviously. So sites recently completed was the first section of the plan. Here's a map that tells you things that are completed. Again, 2020 to 2021. And then a map that actually has the buildings on it. So here you have, this is the prior map. Can you see it? Where it says 20, because it's blanked out on my screen. So to 2016, but if I page down, right, you'll see how things changed. Like there were some images that are changed. We had renderings. We actually have real buildings, stuff like that. Not a lot changed in that 2015 to 2019. And it's different parts of the neighborhood, right? So here's the original. And the change. Now we have sites completed 20 to 2021. Here are the new things. There's only one major project that's been completed, and that's 601 West 29th. That's block 675, Betty.
Yep, I know.
Sites under construction. Now this is what was under construction in 2019. And now we have more under construction here. We have 312 West 43rd. That was a inclusionary housing plan we heard. 278 8th Avenue. That's the PFASH one for the seniors on 23rd and 8th. 550 10th Avenue. That's the Gotham proposal as part of Covenant House. 606 West 38th Street is still was delayed under construction. As everybody knows, 400 West 57th Street continues under construction. It's never ending. But to go like this, you can see the difference. Here's where we were. Here's where we are today.
Joe, this slide, you mentioned a building for seniors. Is it 550 10th Avenue?
No, that's the.
Which one did you say?
That's this one here, 278 8th Avenue.
Oh, that one. Sorry.
Then we go site to the completed public review. There's only one, and that's the Captain Post building on 52nd Street, still not closed. Completed public review back in 2015, still not closed with HPD. Sites. So that's what it was in 2019. Now here are the items that are under public review. That completed public review. Slaughterhouse, 493 11th Avenue. The Chelsea Nitra buildings. 201, 207, 7th Avenue, completed public review. 500 West 28th Street, that's the demolition that Related did on 28th and 10th. The Chelsea Nitra, the Hudson Guild site, and still Captain Post. So again, going back, that's where we were, that's where we are today. So certain projects did actually move ahead. Next section, under public review. Here's where we were in 2019. For the Slaughterhouse, 565 West 23rd, 7th Avenue, 25th Street. Today, we now have the DEP site and the MTA site under public review, and we have two CHEC sites, Hartley House and 454 under public review. So to go back again, things that were there that came off, 7th Avenue finished, 565 project collapsed, Slaughterhouse has been approved, 28th Street approved. And there we are today.
Joe,
Yes.
where is the Till building in Chelsea in this whole thing?
201, 207, 7th Avenue, right here. That was right. That was something that was under public review. Now it's completed.
But it's not, now it's completed?
The public review is completed.
No, but the building.
The building is now up in, the building is, actually, Betty, it's in the wrong map. It's under construction now. Construction just started last week.
Finally, okay.
Yes.
So under construction.
The contract was registered with Office of Management and Budget just 3 weeks ago, and the construction fence just went up last week.
Great.
So now we're the HPD or the ESD, Empire State Development pipeline. We have the Harborview site up here on 55th Street. These are city-owned buildings, 552 West 52, 460 West 37th Street, 500 West 52nd Street, and then the CUNY site here. These are city sites, HPD. This is NYCHA, and this is 460 West, and this is ESD. The NYCHA site in our budget was actually shown that they intend to move ahead with it when the budget response came back from budget this year. We haven't heard anything else about that since. And then proposed developments. We had a whole bunch of things proposed. We proposed Hartley House. It's now under public review. Fulton houses, all the various sites in Fulton houses. All of those have moved ahead. And so when you look at today, the only thing that is still floating in the air as things we talked about wanting to move on is addition over the Morgan Annex on 29th Street and that small parcel of Port Authority land, which in fact, they are proposing that it still could be used as a possible housing site. And that brings us to the sort of broad end of the comparison. And I want to just close this out and show you what it looks like in the detail. We won't do the whole thing at all. So the detail then gives us a map, gives us all the sites, goes through the same sort of pointers. But after we look at them, it goes site by site. And this is all now being amended and updated to capture the correct number of units in the AMIs on each and every location. So these are all completed buildings with affordable housing. And then there's a chart that lists everything by AMI band and gives totals. And then we go into sites under construction. So this is, again, a lot of the new information. Again, some of these titles are wrong. This is being fixed up. A few buildings we approved for inclusionary came back with additional units at 130 or 100 AMI. So we originally did an approval and then they came back with something else. And again, a chart with all the details. There's a slaughterhouse. Seventh Avenue, Betty.
Yay.
And then a whole slide about NYCHA and what that will mean. Again, with totals. So we'll look like this, carefully go through, edit all these things. We've asked, Jesse is working on this, that we have to ask the bid to contact developers to verify that the units that were proposed are units that are actually built. And that brings us pretty much, in this new section is what we will talk about at our next meeting. Whole section of expanding the Westchester Special Zoning District, some of which has been done, but not for housing.
JD, did you have a question?
Oh, I'm sorry, I couldn't see it.
So
I'm sorry, just one thing, this is so terrific. I'm going to suggest even more work, crazy idea, but maybe a slide about the affordable housing we're losing because of demolition.
I think that's actually a great thing to put in this plan. And it won't be that hard to do because we have such documentation.
Yeah, to keep track and to say we're also losing affordable housing through demolition by neglect.
Yep.
Great idea. And I think that we've always had a preamble to this, and perhaps that's something that's highlighted, that as we fight for affordable housing, we're also losing it.
Because it is, by the way, in total, like hundreds of units now when you put all those buildings together. It's not a small amount. When it was one or two buildings, that was one thing, but together a lot. Betty?
I'm not sure where this idea fits in, but I was wondering, as a sort of a newish topic, the opportunity that commercial buildings could be converted for affordable housing. There's an intern that's working with Chelsea Land Use for that topic. And I think it might be somewhere that we could put something in about that.
It certainly belongs in here to figure out how we do it and how we document it, right?
Yep.
Also, I think we should probably put the Port Authority in here, Betty. What do you think?
Yep. Yep. They have a housing site.
Right. And then again, all these were very specific. So here we are proposing to extend the Special Hudson Yards District to pick up the slaughterhouse. This has been done. So this part of the report has not been touched yet. That's a good example of, we came up with an idea, it actually has been embraced and it was implemented. And then here's the rough idea of how many square feet of commercial or residential we proposed. Again, this will take a little bit more time. And working with Hudson River Park Trust, same thing. We identified sites. It's time now to really go back to some of these sites and say, how could we work with the new mayor, the new city planning commission, and the new council member to see if these things can move? And by the way, Roberta, here's our last piece, all the expiring 421As. And we mapped them, you know, and here's when they expired. If you note now, when we started this in 2015, that was a long time. Look at the pile are expiring in 2023 and 2024. So again, something we can really highlight, that 30 years goes by in a quick period of time. I think we'll end there and I'll just take some general comments, Betty.
Two thoughts. One has to do with, I don't know if we'd like to identify that some buildings that have 80/20s or rent stabilized apartments, some are permanent and some will be no longer permanent.
That's
So
that's the 421A expiration that we have mapped.
Oh, that's the same difference?
It is the exact
Okay.
same thing.
And there
yeah.
was, oh, it's the same thing. Oh, okay. Well, I guess we should just be sure we make that clear, not, you know, that is a topic that people can understand.
I actually think we should create a section about the law, like it's the loss of affordable housing. Because I think the demolition can be paired with the 421A restrictions expiring.
Yes.
That's a lot of units.
That
at
would
once.
be
Right.
strengthened kind of section.
Right.
There was something else, but it flew out of my brain.
Any other thoughts or comments on what we've seen tonight?
Kind of a question, I suppose. I don't know if we have data on this, but the Furman Center has been working on this for a couple of years. I know it's an issue specifically the Upper West Side and Greenwich Village, but with unit combinations or combinations of, it could be rent stabilized units, but just
Right.
unit combinations in general.
Like
and
almost impossible to get the, like,
Yeah.
part of the things is that, and that's a good example. So when we talked about this years ago, people are like, what about this idea? That I'm like, right, but how the hell do we get that? I mean, so we really stuck a lot with public land, zoning, and then units produced by some sort of government action, right? And so tonight we've added on so far this whole demolition idea and pairing that with 421A, conversion of commercial buildings, a public action that could actually assist, and the Port Authority sites. I mean, it's not just the one site, Betty, there's other sites that they have not yet disposed of outside of their project area, right? Outside of the terminal expansion that we could talk to them. They have to come up with sites for affordable housing. So it's a good way in the plan, if we adopt the plan, to sort of help move that along in total.
And
So
I remembered the thing that I forgot.
Oh.
For the Fulton houses sites, I feel like they are in a different land or different status. So I don't know how, I think we should kind of think about it. In other words, many of the sites that we are identifying as potential site, I don't know, it just strikes me, let's just think about it, that some of it was very visionary, whether you put infill housing.
No, they've come off, Betty. The only site to be developed in the Fulton and Elliott Chelsea complex is the Hudson Guild site. So that's all that's going to be new.
Oh, that's all those other infill sites are not going to be in the plan?
Well, let me talk about, under the Chelsea NYCHA plan that we worked on together, right?
Right.
We had all those sites, and
Right.
Related came back instead with figuring out a way to increase the RAD rents dramatically So instead of relying upon all that new construction, only the Hudson Guild site will be redeveloped as a building.
Okay, for some reason, I thought maybe there was a map that showed sites that were our infill sites. I could be wrong.
Yeah, no, our original presentation had that, and they all
Right.
came off.
They all came off. Okay.
Except for the Hudson Guild site.
Okay, good. Okay, thanks.
Joe, can I
so-
ask you a quick question?
Yeah, I want to go around the room. Starting with
I'm
Leslie.
sorry. Regarding the 421As and those being removed, do we acknowledge it anywhere on the website, meaning the CB website, as to what people impacted by this should do? Do we alert them?
Well, there has been a group of tenant groups working with HCC pretty heavily on this for a number of years. And I think this is the opportunity now, because most of these are expiring in 2023, that we make this as part of our plan and figure out how we can assist. Because what community district has the most 80/20s in the city? Manhattan Community Board 4. So I think I think we should play a role in this and publicizing and making it pretty solid.
Yeah.
So going around the room, comments starting with Paul Ames. You're on mute. You're on mute. I'm going to come back to Paul, and let's go to Travis. No comments.
I have no comments. I'm getting caught up to speed on this. It's very informative, but I think Roberta and I are on the same page. She asked a lot of questions that I was trying to consider. So
great. Pete, comments, questions?
The only thing I can say, I've been around all of this from the past, and there's so much that went on in the past, and it looks great.
Got to get it updated. Got to make some new ideas out there. Paul, followed by Sabrina.
Yeah, sorry. I've been wrestling with my computer all day. It's not cooperating. No, it was very, I tuned in late. Sorry to be late. It looks very thorough. As Pete said, we've all been looking at this for a long time. I'm amazed at how many 421 days are coming up. Is it my imagination, Joe, or within the last month, since our last meeting, I was sort of surprised to see 421 days actually being discussed in the non-governmental news. I mean, there's this thing called 421. Was that my imagination, or was that getting like broader coverage than we're used to?
It was part of the governor's plan for a new version of it, which has not happened. So trust me, some version of this is going to happen somehow. So we're going to be asked to opine on it, I'm pretty sure. And especially now that we have the issue of the expiring ones. I mean, that's a lot of people's homes at risk.
Right.
It's not that's hundreds and hundreds of apartments.
But I swear, I thought I saw someone reporting who is not one of the usual suspects. And they were saying, well, this is a windfall for developer. What? I didn't know that anyone else knew that but us. Anyway, that's all. Thanks.
Sabrina, followed by Roberta.
Honestly, no comment. I think it's a learning curve a lot. It's a lot of information. So yeah.
Roberta. And then Travis.
So do we have the opportunity to opine on a theoretical 421A replacement? What worked? What?
I would say we should opine upon that separately as opposed to the plan, because part of it is, like, one of the things we learned is we couldn't drag the plan down with the world, but we should certainly be speaking about 421A because that's the right thing to do,
If there is an opportunity to do that, it seems like there is a proposal that is currently being discussed. I don't know if there's an opportunity to do that in May, but could be interesting.
Let me check and see where it is in the legislative calendar, because I want to make sure we keep on, like, we spent a lot of time on the residential FAR issue, which is like sort of timely but then died. So I want to make sure we're constantly moving stuff ahead. And we know we have an interest from the council member in the mayor's office in a revised version of our plan, which we have to deliver. The goal here is talk about it April, May, adopt in June, so we can get out there and start getting discussed. And then we can maybe pick it up in the summer if it will still be floating around, I'm pretty sure. I'll just make a note though.
Wonderful.
Travis.
Oh, can I add one more thing?
Sure.
A little bit related, which is just the governor's budget that passed included funding for commercial hotel conversions to residential, but did not include amendment to the multiple dwelling law in order to facilitate those conversions. Right. Is that something that we would want to?
We're also trying to figure out where is that, you know what I mean? Like part of this is, I'll make a note there too, because that's one of those things that eventually this is going to come moving along, and we've opined upon that a lot, so we should be able to be part of it. Travis?
Yeah, Joe, I just want to know, where does this document live as like a resource for folks? Because I've been in conversation.
It's on the community. The old version's on the community board website.
Okay, and the new version will reside there as well. We
have to adopt it first.
Okay.
JD and then Dolores.
This is just terrific. It's a marker. It's incentive. It shows what we've accomplished. This is fantastic. I want to give you even more work. I know this is
Thank you so much.
I know this is probably not possible, but my curiosity is we're losing affordable housing through the demolition. We're losing this and that. We're gaining through the efforts of the Housing Committee to create and support. Are there any statistics to show how much luxury housing is being developed, how much moderate middle income units we're getting, and how much we're losing? Are there statistics? And that's especially important for the Clinton Special District, which is mandated to have a balance.
So here's a fascinating piece of information. When we started this process back in 2015, we first went to HPD to get that information. And they literally told us it is not in any form that is compiled, whatever. And when we produced this, the planning department at HPD said, thank you so much. This is the fullest like inventory of a community board we have. It was one of those moments of like, huh? And Roberta, having worked there, that's one of those moments where you can't quite process that there is no central registry of what happens. It's balkanized all over, JD. So part of what we do, by the way, for community members that are old, we have a companion document called the Affordable Housing Inventory, which is on the community board's website too. That gives you everything that's been done historically since 1973. And that is very specific. And you should be able to look at that to see. And then again, HPD said, thank you for that, because they didn't have that. I'll leave Dolores and then Maria with the last word on this. Dolores?
So the great new font, great job updating the font. That's a joke. Okay. But just thinking about what both Leslie and Roberta were asking more questions about 421A, perhaps what we should be thinking about is to host a forum.
Mm-hmm.
Obviously,
in this
later
year,
in the year.
In this calendar year, because all these expirations are coming next year.
Right.
That sounds good.
And I think that's something where we can have our electeds participate. We can have some of the housing advocates, maybe some legal folks, and then a little bit to both what Leslie and Roberta were both speaking about, perhaps to provide some guidance for those that may not have recognized that they are in a 421A and they're expiring, and what does that mean? What are their protections, et cetera?
And also now that we can probably have in-person meetings in the fall, right? Like you want to do a forum that's people, because I think that's the most important thing happening here. Yes, Roberta, sorry. And then
Roberta?
Okay, thank you. Sorry, I'm so sorry to prolong this. I am curious if we have ever thought about bringing in something related to housing quality, for which we have HPD housing maintenance code violation data that I've worked with before, and then the other is like OCA eviction data, because it seems like of concern to the committee. We're seeing, I think a greater number of housing maintenance code violations greatly impacting the quality of like existence for residents. And then also, I think there's a lot of reason to worry about a substantial number of evictions coming in the next, year or two.
I think we could possibly bring in a section about the housing maintenance stuff, because that is, if it's properly extracted from HPD, we can put something in there about it, like our top 30 buildings of code, like something like that, right? But I think if it's neighborhood wide, it's not going to help. It's going to get a trend more than an action. And our goal here is in this plan is to create actions that happen over time. I think it's remarkable that we started this in 2015. It is now 7 years old, and things have moved through a process, and there's actual production happening. So in a companion piece, if we're talking about preservation, and I did have a screaming match with HPD 3 weeks ago. I said I want them to put the P back in HPD and do preservation, to highlight the most troubled buildings, to say, let's make that an activity in our community board, so you come and help preserve these buildings and these people's quality of life. So I'm going to actually throw that at you to come up with our next meeting to see how we can extract that information out. That would be fantastic. And Maria, you got the definite last word. And by the way,
yay, Roberta.
By the way, Roberta, that's a really good thing, because that's what we used to do that in years past. Like a decade ago, we had, here are our top 30 buildings, and HPD would do like zeroing in to help tenants like that. That's a good idea. Maria.
Oh, I wrote down the suggestions by the committee members. I thought they were great. And this document is awesome. I remember when I first joined the board and I saw it, I was like, this is so informative. I don't think it was 94 pages when I first saw it.
No, it was not. It's grown.
Yeah, that's it.
I just remember Christine screaming at you to finish it so that we could post it on the website before the end of her chairship.
Yes. It was one of these, this has been a major effort by a lot of folks, and also a lot of the community planners at Clinton Housing who did the legwork and the gathering of the documentation. We should just note that Savannah Wu, current community planner, has continually been compiling data to make this thing up to date. Because if we present bad data, it's not a credible report, but if we present good data, it really is. So I want to thank everybody for participating tonight. It is 8:15. We've done a good job. Is there a motion to adjourn? JD, motion. Second by Roberta. All those in favor, raise your hand and wave good night to everybody. Thank you to the public. Thanks so much. Good night.